Good afternoon and welcome. I see our guests filing in there at the bottom of the screen. We are a couple minutes off our target, but thanks for being patient with us. We're so excited to have you join us today for a parent's guide to breastfeeding, bottle feeding, and in general, feeding your baby. Fed is best, mamas. We hear a lot of talk around breastfeeding versus bottle feeding and all the things, but loving and feeding your baby is the very best thing that you can do. And so we're going to talk about that today. We have some wonderful experts joining us, Dr. Nicole Torres, as well as Alicia Hing, who's a certified lactation consultant. We will let Alicia just jump in if at any point we've had some audio issues. So Alicia, if the audio gets working, you just jump in and we'll know you're ready to go. But I am personally invested in this topic. I'm always personally invested in all of our parental guidance topics, but this one is very top of mind. I am expecting my baby, well, yesterday, but she hasn't made her arrival yet. So hopefully in the next 7 days, I will be venturing again on this journey of breastfeeding, bottle feeding, feeding my baby. So I have a lot of questions, and I hope those of you who are listening do as well. So before we get started, a couple housekeeping issues just to direct our time together. But if you see that chat feature at the bottom, I always love to know, where are you listening from? Are you a first-time mama? Are you a caregiver? Are you a grandparent? So tell us, where are you listening from? And if you're pregnant or expecting, tell us in the comments. We love to know. We also love to know if there's certain topics that you want us to cover that would be of help to you. We want to serve you with these webinars. So my name is Sierra Bragan, and I'm the owner and founder of Miami Mom Collective. We are Miami's premier parenting resource and community. We host events for moms and families, workshops, training, things like this. We love partnering with UHealth Jackson Children's Care to bring you this series. And I want to say, check out parentalguidance.org if you haven't already, because there are dozens of resources, previous episodes available to you there. So that's parentalguidance.org, tons and tons of resources, and you can access them all right there. Watch them in your own time, send them to a friend. This one will be available via recording as well. So give us a week or so, we'll get it up on the website and you can share it with a friend. But you see the chat feature, but also the Q&A feature at the bottom will allow you to ask a question to one of our experts. So lots of questions today, but if you have something specific that we haven't covered or you want to jump in the conversation, we love that. We ask that you put it in the Q&A feature so that we can be sure to get it in front of our experts. So again, don't be shy. Use that chat feature to talk, to tell us where you're listening from, to tell us if it's your first time joining us. But just welcome, welcome. We're so glad to have you. Before I introduce our experts, and you have to bear with me because as a pregnant woman, if any of you are, you understand, you got to catch your breath every now and then. So I feel like I'm just catching my breath all the time. But I want to tell you a few things about UHealth Jackson Children's Care. So they offer exceptional pediatric care all around South Florida, and it is the only pediatric program in the region affiliated with an academic medical center. So this includes children's only emergency rooms, walk-in urgent care centers, specialty practices in Miami-Dade and Broward, and of course the Holtz Children's Hospital, which is one of the largest children's hospitals in the Southeast United States. So the emergency rooms there at Holtz, as well as Jackson North, South, and West, are available to you 24/7, and they're staffed with board-certified pediatric emergency medicine specialists. And at the emergency rooms, they say the waiting rooms you're generally seen within 15 minutes, which is just unheard of. So I hope you never need it. It's what I always say. But if you do, Holtz Children's Hospital is the place to go. So they also are certified in pediatric advanced life support. So you're going to get the best of the best. Well, I'm excited to get us started. And Dr. Torres, thanks for joining us. You are kind of like a familiar face around here. You've been here before. This is not your first rodeo with us. So thanks for joining us again. I'd love it for maybe our new listeners if you just took a minute to introduce yourself and tell us a little bit about yourself.
Sure. So I'm always happy to do this. This is a lot of fun. So parent education, I think, is at the heart of what general pediatricians do. And that's what I am. I am a general pediatrician for the University of Miami and for Holtz Children's Hospital. So I spend almost all my days taking care of the littlest from newborns all the way through young adulthood. I spent some time in education and teaching medical students and residents as well at Holtz and at the University of Miami. But my first passion is clinical medicine.
Awesome. Awesome. Well, we love pediatricians, as mamas. And I think one of the things that is unique to you, not to everyone, but one of the things I love about you, Nicole, is that you're a mama too. And so
Yes,
sometimes I'm
yes.
like, give us the pediatric perspective
Mom
as a
version.
mom, you
Right.
know.
Yeah. That
So I
perspective
appreciate
is
that.
definitely important. It's a lived experience. And I think that really, it just provides one lens, right?
That's
Every
right.
mother's experience is different, but there are a lot of similarities. And yep, I do. They're a little bit older now, almost 12 and just turned 14 years old.
Wow.
So
Oh my goodness. Yeah, you're
yeah, we're
getting
in the
into
thick of it.
the bigger years. That's
Yep.
awesome. So great. Well, let's talk about the little tiny
Sure.
people. And let's just kick it off. I know you as a pediatrician, you're seeing moms when they're coming, their 6-day appointment or whatever, and then all from there on. And I'm sure moms have lots of questions about breastfeeding and feeding their babies.
Absolutely.
So, and then again, Alicia, if you're there, if your audio gets to working, just jump in anytime. But let's talk about how soon mamas can start breastfeeding after delivery.
Right. That's ASAP right away. So direct skin to skin and oh, there she is.
There she is,
Yay.
Alicia. She's like, wait a minute, I know
She
this
got
answer
here just in
too.
time. So I said right away immediately, but I will let Alicia take over. That's a great question for her.
Oh, well, Alicia, yeah, introduce yourself. Okay, unmute. Can you unmute yourself? Can you hit that unmute button? Yeah, perfect. It looks like you are working. You are in the hospital today.
I am, of
You
course,
go.
always
You're
working.
like
Sorry
in
for the technical
between seeing
difficulties.
mamas. I love it. I love it. Well, tell us, introduce yourself. I know you're a certified lactation consultant. Tell us a little bit about how
Yeah.
long you've been doing that. And then we're jumping in about when moms should begin their breastfeeding journey.
Okay, perfect. So I am one of the lactation consultants here, Jackson Noor. I've been doing this now for over 10 years.
Awesome.
The time has really flown by. It doesn't feel like it's that long because it's something I'm really passionate about and I enjoy it. So it doesn't feel like work to
That's
me. So your first question, oh, and some of my background, I do have a neonatal ICU background. I
awesome.
started off in peds and then went into NICU. And from there, I really saw the need for supporting breast milk production, initiation, working with those small and fragile infants, and then transfer that now into the well baby area where I've been working now for 10 years.
That's awesome. Well, you're
Yes.
doing good work as mamas who I personally have used a lactation consultant because you just kind of, I think, believe the can be a lie of like, it's so natural and it just should be so easy. And I'm like, it is not. And
Yes, yes,
so
very
praise the
true.
Lord for lactation consultants. We're doing great work. So talk to us about how soon moms should start breastfeeding if they want to.
Well, that is something that should be initiated immediately after the birth of the baby. The baby comes skin to skin with mom, and during that golden hour period of time, which is that first hour of life, the baby goes through the multiple phases of they move into the position to breast to feed. They smell mom, smelling similar to the amniotic fluid, and then we help support them in that first hour of life. Now, not all babies are ready to do it. So I always encourage the moms, just to cherish the moment of bonding and meeting your baby for the very first time. And then, later on, as the next feeding or the following feeding, we're there to help support. If not lactation, then of course our nursing staff who are all trained to support our moms with that initial breastfeeding
That is
experience.
so awesome. Yeah, that sweet first hour. I think anyone who's had a
Yeah.
baby knows how precious that time is. Now,
Mhm.
how do you know if your baby is latching correctly?
Well, many times you will feel it if the baby is
Yeah.
latching incorrectly. So having the baby's mouth wide open, of course, positioning the baby close in proper alignment with you. And those are things that as a lactation consultant, we're teaching the moms hands-on. It's very beneficial. And of course, I do teach the breastfeeding classes, but that gives the didactic, right? But working with these moms from the very beginning, showing them how to position, what to look for in a good latch, baby's mouth wide open, looking up toward the breast, you know, the chin gently touching the breast, supporting the head and the back to help the baby now lunge forward to onto not the nipple, but onto the areola. Once the
Right.
baby's in that proper position, you then have tugging on the breast. Should not feel like pinching. That's a classic sign that, okay, baby's not doing it correctly. If you're feeling pain throughout the feeding, not just during the first few sucks, that is an indication that maybe you need a little assistance in getting the baby to go on properly. And always with nipple pain, prevention is better than cure. So if we can get these babies started, you know, latching on properly from the very beginning, we can then prevent some of the discomfort that moms may feel and also other issues along the line with milk transfer.
That's so great. And it's just so important to seek that help because I know with my last baby, she was my number 4, and I thought, we got this down. This will be so easy. But every baby is different.
Exactly.
And we really struggled. And I almost was like, I can't do this. It's never been so painful. I don't know what's wrong. And then I met with a lactation consultant after going home, even. I
Yeah.
sought that help, and she was able, all the things that you said, you know, there's all these little checklists in your head. And when you're sleep deprived, it's hard to hang on to all of that. But getting the help that you need can save you a lot of pain and also can, you know, protect that journey if it's something you continue. So that's great. Thank you for that.
Definitely. Yes.
Okay, what about how do we know when baby is hungry? Because sometimes you can feel like you just ate. How are you hungry again? Like, how do you discern?
Right. So it's based on baby's feeding cues. So initially, we're looking to see the baby gently awakening, you know, and that may be the baby's in the crib, they're still asleep, but the earliest feeding cues may be a yawn. They start to, and then they go back to sleep. I always tell my moms that's them saying, okay, I'm about to wake up, time to get ready. If you need
That's
to use
right.
the
Get yourself
restroom, this is
ready.
a good time.
Now's your chance.
Exactly. I encourage them to have, you know, your water, your healthy snacks close by, because that may be an opportunity to, you know, grab something really quickly. Then as the baby starts getting more hungry, they start moving more. You know, now they're stretching the arms. Now they're, you know, coming out of the blanket or the little swaddle that you may have them in, bringing the hands to the mouth, sucking on their lips, sticking out their tongues. So now they're becoming a little bit more overt with their signs. When they're truly hungry, they then cry. But you
Yeah,
don't want your baby crying every single time they're ready to eat.
I
You
need to
know,
eat.
if you're catching them at the early phase, that's a great time to open up the blanket, change their diapers, bring them skin to skin, and then have them go through seeking the breast at that point. So it's always best to get them at the early part. So that's how you pretty much tell that they're hungry.
That's good. Okay, what about when this is something I feel like I always dealt with, but especially in those early days and months, they're just like they get so sleepy and they fall asleep during the feed. Just some tips and tricks on like how to keep your baby
Yes,
awake and
yes.
engaged.
So I did say skin to skin. That's a great
Yep,
way the baby, they normalize. They realize where they are. Okay, I'm at the food
that's
source,
good.
the food farm right now.
That's very
Um,
good.
Now, having them so super swaddled, hat on, socks, um, covered over, they're not going to wake up.
Yeah,
Think of us in the dead of winter, and you put a big comforter over us. We're going to be nice and cozy, and you don't want to wake up and eat.
that's right.
So it's really up to the mom to stimulate and help arouse the baby. Very common in the first, especially the first days of life, particularly the first 24 hours, when the baby's not really even feeling hungry. So we're pretty much getting into the practice of it all during that first day of life. But it's very important to arouse and awaken the baby so that at least in a 24-hour period, they're feeding a minimum of 8 to 10 times during that first day of life. Now,
Yeah.
as they start awakening and the lights start coming on, usually it happens at night, unfortunately. I always kind of preempt
Why do the
my
lights come
parents.
on at night? Yeah,
It
why?
happens at night when they start to finally awaken and then
Yeah,
they start cluster feeding. And that's all in the beginning phases of establishing that milk supply. I
yeah.
know it can be daunting. Like yourself, I'm a mother of 4, so I went through it, right?
Yeah.
So I
And
let
if you
them
don't
know.
know or you're not expecting it, you can feel
Yes.
It's
And of course,
crazy.
the
Yeah,
doubts come in like, do I have enough?
right.
Is the baby hungry? I don't have, enough. So you start questioning yourself. But
Right.
if you know ahead of time, okay, this is the expectation, then you kind of relax a little bit. Okay, yeah,
That's
she
right.
told me that this is going to happen. And that's how that milk supply, they're putting in their order. The
That's
baby's
right.
putting in their order for future
That's
milk
good.
supply in the next 3 to 5 days.
That's good. Oh, I love that. Yeah, I feel like when you can expect it, you can mentally prepare. I feel like with my
Correct.
first baby, no one told me that. And then a friend
Yes.
texted me and said, "Oh, have you started cluster feeding yet?" And I'm like, "What are you
What?
talking about?" And then when she told me, I thought, "Okay, this is normal. Don't go crazy." So that's so helpful, which is again another reason why we need to normalize these things, having these conversations and seeking out the help and support of your pediatrician, of a lactation consultant. I love it. So great. Well, let's talk about on that note of, supply and those things. Should we schedule our baby's feedings?
So the baby is the scheduler. Um,
Baby's
it's
the boss.
based on the baby's cues and the baby's demand. Very difficult because you can actually miss feedings that way. I know there are a lot of theories out there that talk about, scheduling. So now the baby's showing you the cues, but then you're not listening to the cues,
Yeah.
right? So at the baby's peak time of interest, you've totally said, no, it's not time to feed. And
Mhm.
that now can have negative effects on your milk supply.
Right.
So definitely not scheduling the feeds, but following the baby's internal clock. So
Yeah.
they're going to demand the feedings. And of course, um, I said in the first day or two, they may be very sleepy. So you are now arousing and wakening them. Don't let them sleep more than 3 hours. If they're still fast asleep, arouse them, bring them
Right.
to the breast, skin to skin, stimulate them, and offer the feeding. And then when they start demanding it, you're there to give it to them as much and as often as they need.
That's great. I'm like, what if someone told us, like, oh no, it's not 12:30. You can't touch that lunch yet,
Exactly.
Especially like I wake up early one day, I'm gonna be hungry earlier.
Exactly.
That's good. Okay, what about you said 8 to 10 feeds there early on, but how often should we be feeding the baby?
So we stay away from an increment of time,
Mhm.
like saying feed baby every 2 hours.
Right,
Instead, again, cue-based feedings. So
right,
that's how often, if the baby wants, maybe they may eat more often in the daytime. And then at night, later on, they may sleep, up to 4 hours. That's allowable, but that's now milk supply is here. The baby's driving, getting what they need, and also making sure the baby is being followed up by the pediatrician, and they will now be monitoring the baby's weight, degree of weight loss. All babies do lose weight. That's another factor. Some moms get a bit anxious. Oh, the baby lost weight. I must not been feeding them sufficiently. But in the first week of life, they do lose a percentage of their weight loss, which is expected. And then they should be regaining that weight on a consistent basis, about 5 to 7 ounces per day. So they will eventually regain that weight by 2 weeks and then continue increasing weight
increasing from there.
thereafter. Mhm.
That's great. Awesome. All right, talk about pacifiers because I hear conflicted things of like, does this confuse? Is this okay? Like, talk to us about that.
Right. So pacifiers have a place. However, our goal is to get, again, on-demand feedings. If you have a pacifier in the baby's mouth, and the baby's only 2 days old, a week old, 2 weeks old, maybe. Milk supply is not fully established yet, which pretty much takes anywhere between 3 and 4 weeks
Okay.
post
Oh,
delivery. So prior to that, it can actually inhibit or decrease the overall milk potential of
okay.
the mom. So we try to limit it or educate our moms to limit the use, holding off until 3 to 4 weeks when the
Okay.
milk supply is established. After that, if it's mom's desire to use one, introduce it, then it's provided for the baby after the baby's completed a feeding to soothe them, help them fall asleep. Once they do fall asleep, if they spit it out, leave it out.
That's
That
good.
way, when the baby's ready to feed
You
again,
see those
they'll
milk
start
cues,
queuing.
right?
Exactly, they'll
That's
start
a good.
queuing.
I never thought about that. I just think, "Oop," but you could miss a hunger cue if that passes by.
Exactly,
That's good.
exactly. So for that reason, we tell our moms to delay using it in the early weeks of breastfeeding establishment.
While you're establishing that supply. I didn't realize it could take 3 to 4 weeks to establish the supply. That's a good fact too.
Yeah.
Let's talk about warning signs of just breastfeeding problems. Like when do you feel like, oh, this might really be a problem?
Okay, so if you have a baby that you did mention sleepiness. So if the baby's not awakening for feeds, when you do bring them to the breast, they suckle for a few minutes, 5 minutes, and they're falling asleep. That can be a clue that something is going awry.
Mm-hmm.
So definitely seek support in that instance. If you are experiencing acute engorgement that's not being relieved by putting the baby on the breast with great frequency, then it may be a latch issue or a milk transfer issue. Seek support. If you experience that same engorgement and now you're seeing or feeling feverish or having chills, um, then that can be a sign that you as a mom may need to seek some support. Maybe there's an infectious process happening. You're seeing red streaks in the breast, very painful, tender areas. That may be a sign of mastitis. So there are different things that you need to seek assistance for. If the baby is missing their feeding sessions, so they're not getting that minimum 8 to 10 feedings a day, they are feeding 4 times a day. That baby's going to become dehydrated. They're
Mm-hmm.
not going to have the energy to eat. So seek assistance in that. And if by 2 weeks of life, I said 2 weeks, babies should be regaining their birth weight. If that does not occur, then there may be some feeding issues there with milk transfer and supply issues as well.
That's great.
So that's just a few. I'm sure there are many
Yeah,
others
but no,
that
those
can
are
come
good. The
about.
main ones for sure, for
Yeah.
sure. Wonderful. Again, just to our audience, if you have any particular questions for experts, you can drop those in the Q&A. I saw one come in that I think is going to be a great question for Dr. Torres. So I'm going to hold off on it, but we're going to get to it. But if you have anything for Alicia, as we talk about breastfeeding, just drop it in the Q&A there. All right, talk to us, Alicia, about those who are, going to pump. How soon can they start pumping for baby?
Okay, so they're different. Every pumping is individualized, right? Of course, my practice is based in the hospital, so there are times that we may need to get a mom started pumping in the early days. So I'll talk about that at first. So if a mom has flat or inverted nipples, the baby is not able to latch, having difficulty latching, requiring full support in order to position and latch onto the breast. Because sometimes with flat nipples, you're still able to latch on, but with a lot of support, and then mom just isn't able to do it. If by 24 hours the baby's not latching, we need to start stimulating her supply otherwise.
Yeah.
Of course, if there's separation, babies in the NICU, for instance, or mom is separated for whatever reason, her own health, then we start her pumping, ideally by 6 hours. So that's where early pumping may be indicated in the hospital setting.
Okay.
Now, if there are issues such as baby has high levels of bilirubin and is requiring phototherapy, if the baby is on like not putting out sufficient output and we need to increase mom's supply in some way, we may start her pumping earlier as well. So it's a means of stimulating supply, not necessarily obtaining supply.
Okay.
Another way that an alternative way is using hand expression. So if we need to, what I say, quote unquote, top off the feeding. We
Right.
may breastfeed or assist the baby, but if the baby's not doing it, overly sleepy, maybe the baby, mom's a diabetic and we're monitoring the baby's blood sugar, and we need to make sure that level stays in the safe zone. We may start hand expressing and getting those rich drops of colostrum out as another means of stimulating and then feeding the baby. Now, later on, after you return home, for instance, you're going back to work,
Right.
and you want to start procuring a supply for later on, then waiting again for that 3 to 4 week window when the supply is fully in, then you can start pumping maybe once or twice a day. Early in the morning is a great time because your prolactin levels are elevated during that period of time. So you may get a larger output. So once or twice a day to start your storage, your stock in
That's
your
great.
freezer.
Yeah. Oh, there's so much that goes into it. And that, and again,
Yeah.
it's for a postpartum mom who's so tired, it can feel overwhelming. Here is a couple questions that we received from our audience. The first one, you spoke about the colostrum in the beginning at the hospital, and this mom said, when it's just your colostrum coming in at the hospital isn't enough for your baby. She said, I feel like sometimes hospitals push supplementation right away, and like, how can I avoid this?
Exactly. So colostrum is a complete food. Baby's stomach size is very small initially, about a teaspoon per feeding is
Amazing.
more than sufficient for the baby. And we monitor the output. So what goes in is going to eventually come out, right? So with those frequent feedings, 10 times, maybe even 12 times a day, because of those babies cluster feeding, they may feed more, more frequently. So with all of those feedings in the first day, we're expecting at least a minimum of 1 pee and 1 poop. So with that output, we know that, okay, 24 hours, we're good. Then we move on to the second 24-hour period of time. So for each day, we add an additional output measure. So second day of life minimum, we want to see the baby having at least 2 voids and 2 stools.
Gotcha.
And then that is the same for the third day of life. So that's how we monitor them in the hospital setting to ensure that the colostrum is sufficient for the baby.
That's great. That's great. Oh, I'm learning so much. You can do this
Yes,
several
you're going to be
times and
ready.
still not know anything. Yeah.
Yes, you're going to be fully ready.
I'm going to be ready. This is good. Okay, here's another mama who's 3 weeks postpartum. Congratulations to you.
Yes.
She says, my baby lost weight the first week and my milk supply is around 30 to 40 milliliters with a pump. She's on week 3 postpartum, pumping around 5 to 6 times per day. She said, will my milk increase sooner, or has she lost her chance? I guess she's thinking about supply.
Well, is the question I'm going to ask her is she also breastfeeding? I know she's pumping 5 to 6 times a day. That in addition to breastfeeding, her supply will come in. Yes, and actually at about around an ounce and a half where she is right now at 3 weeks, she's on target. She's on target. By 4 weeks, babies are getting close to 2 ounces, which is 60 mLs. So keep working at it. Keep putting the baby onto the breast first. And you can wait about 30 minutes to an hour and then pump afterwards. That way your body has an opportunity to refill fully.
Gotcha.
Although it doesn't fully empty, it never runs dry. It'll slow down, but at least you give your body a time to refill, resume, and then you can pump again.
Amazing. It is so amazing how our bodies are made to do this. It's incredible.
Yes.
Okay, let's talk about special diet while we are breastfeeding. Is there any certain rules we should follow? Things we should
Okay. So there are no hard or fast rules. There are simple guidelines. Okay, so a healthful diet, eating, you may want to space out your meals instead of eating 3 full meals. You may want to, space it out throughout the course of a day. And of course, healthy snacks throughout, lots of fluids. So that includes water, smoothies, health drinks, different things like that. But a good guideline is about 8 of those 16-ounce bottles of water, so that, and it could be juices, it could be other types of liquids, but that's about how much is the requirement. Foods rich, a healthful diet, rich in proteins, lean meats, calcium, vitamin D, and protein, folic acid. Another thing I would say is to continue taking your prenatal vitamins.
That's right.
If you were taking vitamins and iron during your pregnancy, continue to do so until your obstetrician tells you otherwise.
That's
because
great.
the nutrients provided, the additional vitamins, will help also to support a good milk supply. If there are certain foods that you've eaten, you may have had a craving for spicy foods one night and all of a sudden you're feeling a little way and the baby's a little fussy or gassy, then maybe you want to hold off on those foods in the early days until the baby's GI tract also becomes adjusted to your dietary intake. There are some things when it comes to, uncooked meats, such as raw sushi. There are some schools of thought that say, okay, now the baby's out, you can have your raw sushi, but just be mindful of the source of the sushi that you're getting and their preparation techniques to ensure that it is safe for you to consume. As far as mercury and fish, fish is very helpful to our diets, but those that are high in mercury, such as tilefish, mackerel, there's another one, kingfish, you want to limit those, and also albacore, the white fish tuna, that is higher versus the other chuck like tuna. So once a week, a 6-ounce serving would be adequate, but try to limit those high mercury fish groups from the diet. So that's about it.
Yeah. Okay. Well, circling back, because I have a question from our audience about supplementation. Then we're going to come back because I have a couple more questions about diet and things we can eat and drink and not in nursing. But okay, this guest is asking, is supplementation necessary if the baby drops birth weight below 10%?
So the first supplementation will be mom's own milk, right? So we do see that sometimes, and automatically, like I'll get a call, mom may have left here exclusively breastfeeding, and then we get a call that the pediatrician is suggesting formula supplementation. So just so you know, we also offer for our moms that have delivered here at Jackson North, they can come back for a complimentary one-on-one consultation with one of us. So, to have that support like right away is so important. Amazing. Because perhaps there was an issue with her milk transference, for instance, or if the baby was sleepy. So if we can eliminate those little, I guess, speed bumps in the way that may have caused this increased weight loss, then we can sometimes curtail that immediate need for the formula by, say, pumping, and then we get 60 mLs. It's like, wait a minute, it's not a supply issue, it's just it wasn't getting to the baby. So just so you know, be checked first, have a consultation, meet with one of us, or even just a warm line, give us a call before that. It's not always 100%, but of course, if the doctor deems so and there's no other way, then that is a medical indication for it.
It doesn't mean straight to formula. Like you said, it could just mean, let's try to give her your milk in another way. That's great. Awesome. Okay. And I've got another one about eating and drinking in breastfeeding. And then Dr. Torres, jump in anytime if you've got something to add as well. Okay. I have heard it said, someone told, and it wasn't until my 4th pregnancy, but someone in the hospital said, don't forget, a baby can't metabolize caffeine. So don't drink any coffee for the first 2 weeks. And I was like, what? This is new information for me. So talk to us about, is it safe to drink coffee? Is it wise? Maybe it's safe, but maybe it's not wise. I don't know. Talk to us about caffeine and then also alcohol, of course.
Okay, so caffeine is allowable. It's a safe substance. In fact, we use it in our preterm babies that need a little boost to help them remember to breathe. So it is a safe substance to use. Again, if you notice, excessive use of anything is not advisable, right? So moderate use, 1 to 2 cups of coffee a day, because mommy is a mommy too, and sometimes you need that wake-up call, right? So it's allowable. However, if you see that the baby is reacting negatively to it, they're overly awake or irritable, then you hold back on it. But it is an allowable drink you can have in the morning to get your pick-me-up as well. As far as alcohol use, of course, again, overindulgence in anything is not good. However, an occasional glass of wine, an occasional drink of beer, then it is allowable. Now, you do not want to say, I'm going to have my drink and then feed my baby. Instead, do it the other way around. You feed your baby, allowing at least an hour or 2 for that alcohol to metabolize. Not all of it is excreted, but when I say excreted, within the hour, of course, but it will be a lower amount that it should not affect the baby. Okay, so just an occasional, I know some moms are like, I need my wine.
Yeah.
But the benefits of breastfeeding outweigh the risk of that small amount that they may receive in the breast milk.
That's great. Well, I need my coffee, so I'm feeling happy that you
You
said I
feeling
can
happy?
keep it
Yay.
there. But I'll just feed the baby and then I'll have my coffee. That's what I'll do.
Yeah.
Great. Okay, here's a question from our audience. Are there lactation consultants at all Jackson hospitals? Do you know?
Yes, yes, we do
Awesome.
have Jackson, Maine. They have their lactation department. We have ours here at North and also at South. So
Awesome.
there are consultants that, they cover different days, of course. So it just depends on
Amazing.
scheduling. But yes, we do have that lactation service available at all facilities
That
in the
is
Jackson system.
awesome. And great
Mhm.
news about that complimentary visit, even after your baby is born, after you leave. Like, take advantage of that. That can just
Yes,
really, really, really help you. Even if you
yes,
think, I don't need it, but I think you'll
correct.
learn something. So,
Correct. And many times, a lot of times, we can solve the issues on the phone. So a mom may come in, and because it's inconvenient now, traveling with a newborn baby, and it's too cumbersome sometimes for some of them to actually come in, but at least they have us as a resource, and we provide that with our outpatient resource handout that we provide for them on discharge.
that's great. That
Yes.
is awesome. All right. What about when is it time to start offering complimentary foods? I know that kind of is down the road, but and Nicole, you may have things to add to this as well. This was like
Okay.
your wheelhouse.
Yeah.
All right. I'm going to step away.
Awesome. No, Alicia, thank you so much.
Thank
Great, great
you.
insights.
Yeah. So that's a great question. So in general, the American Academy of Pediatrics recommends anywhere between 4 to 6 months to begin the introduction of complementary foods. I like the use of complementary foods because the primary nutrition source for infants is going to be breast milk or formula if babies are transitioned to formula after 6 months of exclusive breastfeeding. Of course, babies can be infants and into the toddlers be breastfed also. If that's what baby and what mom wants. But the complementary part is important because what we're introducing is new foods over the course of weeks, just one new food every 3 to 4 or 5 days as we introduce this new texture. So it's important to recognize that it's complementary to the nutrition that breast milk and or formula is providing. And that's still the primary nutrition source for an infant. So we're just trying things out and teaching them how to accept a spoon and swallow purees, or a variation of introducing complementary foods is baby-led weaning, which is food with texture and not pureed.
Yeah, that's good. I want to
Yeah.
get into that because I'm sure we'll have some questions about that. Before we do babies need vitamins? Do we need to be supplementing them with
So that's a really good question. And the short answer is with regards to vitamin D and iron, yes. So a baby would need to take about 32 fluid ounces in a day to receive the full complement of iron and vitamin D. And that's actually a large volume that not all babies can do, especially in the first 6 months.
right?
So, way back when we used to say vitamin D supplementation for exclusively breastfed infants, but partially breastfed infants, partially formula fed infants, for the most part, need vitamin D. Really through 12 months until the full complement of food now is able to provide that amount, which is anywhere from 400 to 600 IU eventually. And then the iron content is very important. So the iron in breast milk is highly bioavailable, and formula is fortified with iron, not as bioavailable as breast milk. But again, the nutritional needs for an infant around 11 milligrams of iron starting at 6 months. So our recommendation is iron supplementation for all babies starting at 4 months, especially exclusively breastfed infants, and those who are not taking 32 ounces of formula.
Awesome. And those were just the little drops, right? If I remember
Yeah,
correctly.
you can buy them over the counter. You can find them on Amazon. There's many preparations of it, whether it's a full, like syringe full or drops. So I often advise parents, like, look for something. Sometimes we'll even open up Google and Amazon and we'll see, like, this is what's available. If they find something and they're not sure, I just have them snap a picture of the label, send it to me, and I'll tell them exactly how much they need.
That's great. Ah, that's a good pediatrician right there. I love it.
It's
To be
better
able
than
to start with
over
the
or
crib.
under, you know.
Yeah, that's right.
Mm.
Okay, baby-led weaning. Talk to us about that. What is baby-led weaning and how is it different than
Yeah.
the purees?
Yeah, so basically baby-led weaning is kind of flipping the script on the way that you introduce solid foods. So the traditional way is starting with purees and spoon feeding. Never solids, never purees, never cereal for feeding in the bottle. Please don't cut the nipple. That's not good. Because really what we're trying to teach children or babies is how to receive a spoon, move that food from the front of the mouth to the back of the mouth and swallow. So there's, you know, some mechanics to it, and it's not the same as sucking and swallowing from a breast or bottle.
Good.
So baby-led weaning is basically foregoing the pureeing step, using still using single foods, right? And you would just kind of overcook and be super soft and that they can grab. So usually this is like around the 6-month mark where they're able to grab and bring food to their mouths. It's messy. They're kind of, you just kind of put things out and they grab and they shove it in their mouth. And so there's a lot of, you know, fine motor skills that are being worked when babies are baby-led weaned. And so they kind of direct how much they're eating because they're the ones who are grabbing and putting in their mouth.
Gotcha, gotcha. And also just gotta watch for the choking.
Yes, exactly. So we're talking about things like, for example, like, you know, like a broccoli spear that's
Yeah,
overcooked and soft, they can grab
really
and just
soft.
kind of gnaw on.
Uh-huh.
Things that are, I just always think overcooked, soft, mushy, things that you can, you know, squish with your fingertip that they can
Uh-huh.
grab. And in the very
Fear of
beginning,
something.
they're not quite using their fingertips. It's kind of like that caveman grasp.
Uh-huh.
So that's why sometimes something that they can kind of hang on to. But either way of starting complementary foods is fine as long as we're not giving them small,
Right.
hard, smooth, you know, grapes.
Yeah.
Yeah, things like that.
Brr, no grapes.
No
I'm
grapes.
like, I feel like I cut the grapes for my like three
Yeah.
and a half year old.
Yeah, and we still
Like,
peel them and cube them. Yeah.
that's right. He's
Yeah.
like, when do I get to eat a grape? You know,
Yeah.
like a grape. Not yet. So
College. Yeah.
that's right. When you go to college, when you cut your own grapes. Yeah.
Yeah.
Um, too funny. Okay, what about mixing breast milk and formula together? Is that a thing? Is that safe?
So from my perspective, if we're trying to, you know, if we're either, I have moms who sometimes just they want to continue to give breast milk and they're combining feeds, but they need a full, let's say 6-ounce bottle, but
Right.
they want to preserve their breast milk for, you know, for months, and they
Mhm.
want to complete, let's say, the 6 ounces that a baby takes. They can dump it all in one place as long as, you know, as long as it's been handled appropriately, right? So breast milk that's
Right.
been frozen has been thawed. Once it's warmed, or, you know, been used, whatever is
Yeah.
discarded, same thing with the formula, rather than preparing a formula bottle and a breast milk bottle, for
Yeah.
example.
That's good. Alicia, quick question for you. Speak to us about this. And Nicole, I know you can too. I'm just bringing Alicia in for this because I think
Yes.
it's something that we should have covered in the last. Real quickly, tell us the rules for breast milk storage and usage. You know, like how long is it sitting on the counter versus in the fridge and all that.
Right. So they're varying wide ranges, right? So of course, if the baby's preterm, you want to have the shorter duration of storage. So we typically say within 4 hours, it's good at room temperature.
Okay.
And then if it's in the refrigerator, 3 to 5 days. For our preterm babies, we say 3 days fresh in the refrigerator. And then in the freezer, it's good for 3 months up to 6 months in a
Okay.
regular freezer. However, in a deep freezer, it's good for 6 months up to 12 months in a
Okay.
deep freezer.
Mhm.
Once it is thawed, as Dr. Torres said, once it's thawed from a frozen form to a liquid, it is then only good for 24 hours. All right. Once the baby drinks from that bottle, within an hour, it should be discarded. Like don't refeed it, or refrigerate it, because at that point, bacteria begins to grow in it, which can be harmful for the baby.
That's good. Thank you. I feel like we need a little magnet for the fridge, you know?
I've
Yeah.
seen them.
I
We
have
should,
Yeah.
too. I'm trying to think
you're
where
like
I'm like,
expert, Jackson, right?
yeah. Like, hey,
UHealth Jackson
Jackson,
should do that.
send
Hey, do that.
send a mama home with a magnet, you know?
Yes.
I just think that
So
would be
just so you know, we do
oh, good.
we give a beautiful book, Welcoming Your Little Miracle, to all
Love
of
it.
our new moms. And in there it's a vast amount of information on how mommies can care for themselves, things she needs to look for, including, what to eat and how dads and families can help.
Wow.
And then it has a nice breastfeeding section in there as well, which includes a chart that shows mom how to safely, because it's a lot of information coming at you, especially during those first 2 days or 3 days that you're here in the hospital. So we send you home with that resource. And in that resource, it also has scan codes that they can scan, and it has
That's
videos
great.
Oh,
that
that's
are
nice.
associated as well. So it's a great resource for our moms.
Awesome. Love it. Love it. Love it. Okay, Dr. Torres, let's talk about allergens a little bit. We got a question from our audience, and then
Yep.
also want to ask you about introducing peanut butter
Yeah.
before age 1. What's your
Sure. So the consensus is these allergenic foods, particularly peanut butter, eggs, cow's milk, fish, shellfish, anything that we always considered as allergenic should be started before a year of age, which is a departure from what we used to do, which showed that we were actually increasing food allergies by delaying the introduction
Wow.
of allergenic food. So babies can be introduced to peanut butter or other tree nut foods, again, around the same time that other complementary foods are started, with some exceptions. So children who have severe atopic dermatitis or eczema, those are the two words that we use for a skin condition that's itchy and rashy, that denotes allergy, or if there's a known egg allergy, then those children should actually see an allergist or an immunologist to verify if they would be okay with the early introduction of peanuts or peanut products.
Okay.
Mild to moderate or no eczema at all. If the child has already been introduced to complementary foods, you can introduce peanut butter. And usually the easiest way is to take about a teaspoon and a half, and you can either thin it out with breast milk or formula and feed with a spoon. You can mix it up in a pureed food. What you don't want to do is give them a glop of the peanut butter or other tree nut butter, because that can be a choke hazard too.
Yeah.
It can be difficult for them to swallow. So the question about, because I can see it in the chat, about a 2.5-year-old daughter, right, with milk and egg allergy, how do you introduce for the sibling? If the sibling does not have severe known allergy, so it doesn't have an allergy to egg or doesn't have atopic dermatitis or severe eczema, then you could theoretically follow the same recommendation of starting, peanut butter as soon as 6 months.
Wow. Yeah.
It's probably a good question to go over with a pediatrician who knows your family and your children best, and there may be other reasons why you might want to consult with an allergist. But if the sibling themselves doesn't have an egg allergy nor a severe to moderate atopic dermatitis, it should be fine.
That's great. That's a great question too. I imagine as a mom, I would feel so nervous if I knew one of them. It's like, I just want to never let them have it. So that's great. Great answer there. Thanks, Nicole. Okay, so there's a lot of formulas to choose from. How in the world does a parent pick?
It's very overwhelming to go down the aisle and see all of these formulas that are marketed for all sorts of, different things. Quite frankly, I tell parents, pick one, which is in and of itself overwhelming. So I'll just start with things like, do you have a preference in terms of diet? Some families have dietary preference in terms of being vegan. And so you don't want a cow's milk formula. So then we would talk about soy formulas as the primary protein source. Is the baby colicky? Are there reasons to consider different formulas, for example, like reflux, where there's formulas that will thicken in the belly when they hit the acidic environment of the stomach and just kind of thicken up a little bit without having to use rice cereal. So for the most part, though, when we look at different brands, and the things that they offer, I think it's very important to recognize that all formulas in the US are regulated by the FDA. It's the same calories per ounce. So it's 20 calories per ounce of fluid ounce, whether it's ready to feed, so you just pour it and ready to go, whether it's a liquid concentrate where you would have to mix based on the instructions, or powder that you would mix with the instructions. It's the same calories per ounce. It's the same carbohydrates, proteins, and fat. In terms of nutrition, how they get there is kind of like Pepsi, Coke, and, Publix brand soda, where there's differences in formulation, but the nutrition is the same.
Okay,
because
that's
it has to be.
no, it has
Yeah.
to be. Yeah,
Yeah.
it's
And that's
regulated.
the
It's good to
same
know.
with, store-bought formula, store brand formulas as well, which can be a much more affordable option for families who are on budgets that make it difficult to purchase formula, which is why breastfeeding is so great because it's free.
Yeah, yeah. And that makes sense why you say like just pick one because you're not
Yeah,
going to lose the
I
nutritional
know. It's
value of
just
one.
right. It's just
That's good.
difficult because it looks fancy in the packaging and the
A
things
marketing.
in the marketing. But in the end, we just have a conversation about, is there anything in particular of that they value in terms of dietary preferences, and then we'll go
Yeah.
from there.
That's great. That's great.
Mhm.
So what are your thoughts on like European formulas? Are they regulated or is there a
Yeah.
difference there?
So the European Union has their regulatory body for formulas, just the same that that we do for pharmaceuticals.
Right.
And so there are differences between the FDA and the EU. There's differences in the amount of iron, for example. So European formulas tend to have a little bit less iron, and just labeling is different too from the FDA to European formulas. There are European-like formulas in the US that um, are okayed by the FDA. And I think the big thing to remember is that when they're approved by the FDA, the supply chain is intact from manufacture down to when it gets to the store. And so you're confident that there weren't temperature instabilities. There wasn't,
Mm.
a carton wasn't held up at the port of Miami waiting to get distributed to Amazon to then get distributed to your
Right.
house, which can happen with European formulas that are brought in through
Oh, yeah, that
third
makes
party
sense.
kind of
Okay.
things. So that's an important consideration
That
too.
is. Yeah.
So there are European style formulas that are FDA approved, so they're US formulas. And there were a couple that were approved that went through the FDA labeling process and approval process when we had that great formula shortage a few years
Right.
ago, right? When a whole plant was shut down due to a potential contamination.
Yeah. Yeah. Wow. Wow. You did your research there. That's like amazing. I never thought about the supply chain like that and
Mm-hmm.
how with FDA versus something coming, you buy it on Amazon and it comes
Right.
from Europe, whatever.
Yeah,
Yeah.
you're not sure. Plus,
You don't
things
know.
are not in English. So,
Yeah.
the measurements are going to be different. Your instructions are not going to be in English, or, are they going to be really reliably translated? It's just things like, you want to make sure that formula is mixed properly based on the instructions on the canister or the can or whatever. Otherwise, it doesn't have the right calories. It may have too much or too little. It may have too much or too little water, which is a problem in infants and can land them in the hospital.
Gotcha. That's
Mhm.
great. Thank you. All right. I'm looking at our time. We got about 4 or 5 minutes. So audience, if you have questions for us, drop those in the Q&A. I've got a few more, but we're going to start wrapping up our time here. Such a great discussion. Let's talk about mamas who are planning to go back to work and they want to introduce bottle feeding. How should they do that? Can they prepare formula ahead of time? Talk to us about that.
So the introduction of bottle feeding can be tricky, mainly because if babies love their mama and they love to nurse, and it's just as it as it often is, it can actually be a little bit difficult
Yeah.
to introduce a bottle. So I'll tell moms and dads, and this is a great way to involve other family members in feeding, which I find is brings grandparents and siblings and other families a lot of joy to feed. I think sometimes the pressure not to breastfeed and to bottle feed sometimes comes because family members want to be involved in that. And I think that's always such a sweet moment,
Yeah.
So I would say as you can start with, breast milk. So just express breast milk that you have, either you thawed from the freezer, or if you want to just do a fresh pump and let someone else bottle feed.
That's
Babies
good.
are more likely to take it from not mama because they know mom.
They're like, Mom, what are you doing?
What
This
are
is
you
weird.
doing?
But
And
grandma,
so
abuela,
sometimes
it's
that's
okay.
helpful, to start it that way. And sometimes babies just have a preference for mom and nursing. And so doing it before, even in the few weeks before you're supposed to go back to work, is ideal to make sure that they can transition from a bottle nipple to nursing without any difficulties, because they certainly can show preference. Other babies are just happy that milk is getting in their tummy and they don't particularly care.
They don't care how it's coming, just get
Yeah.
it to me. That's great. Awesome. And then did you say about preparing formula ahead of time? Can you do
Oh,
that?
yeah.
Or
I mean,
do
you
wait and
can.
warm it?
I mean, you could prepare, the whole volume that you think that your baby would need, and you would just kind of leave it in the refrigerator, and then they could be, bottles could be heated up, not in the microwave because
Right.
it makes for really hot spots within the milk.
Mhm.
So you can just run it under hot tap water and warm it up that way. So you could certainly do that. There are other nice ways too, where you can just have those little canisters that are divided with the number of scoops you need per water. And so you
Oh,
can put it
yeah.
up for families that way, or just written instructions. You don't have to, but once it's in the fridge and it's warmed up, that's it. It never goes from
Never goes
warmer
back
to
to being used.
cooler, just only
Right.
cooler to warmer.
That's good. And there's so many gadgets available now. I'm like, my mom is like, we didn't have all these things they all have these days to make stuff easier. Awesome. Okay, let's see. We have another question. Here's one. Let's say she's feeding her baby with formula and breast milk, and she tried Similac, and her baby had a lot of liquid bowel movements.
Mhm.
And then he got a bad rash on the bottom. She changed to Enfamil. The situation improved. He's still fussy, has some rash despite all the care with the diaper change. She said,
Mhm.
do you think she needs to try another formula like a goat milk or another brand?
Yeah. So that's a really good question. And the first thing I would say is talk to your pediatrician and kind of let's tease apart what's going on. I always remind families that formula is made from cow's milk, and we're not baby cows. Our babies are not baby cows or baby human. And so the protein component of breast milk is predominantly whey protein, and the predominant protein in formulas, although there are some that are predominantly whey, is casein. Casein is the cow's milk protein. And so there can be some difficulty in digestion there and having issues. Sometimes babies are allergic to the casein, to the cow's milk protein. And so that might be part of what might be going on. So I think the first thing would be, before switching things out, is talking to your pediatrician to distinguish what might be going on. Poops can change from breast milk versus formula feeding because, again, it's the nutritional components are there to mimic breast milk as much as possible,
Yeah.
but it's not human milk. So you can see some changes there. I would probably go see your pediatrician.
Ask your pediatrician. That's great. Thank you. All right. Last question, Dr. Torres. And Alicia too. You guys can both chime in. But do I have to wake up my baby at night to feed them? Or it says for a bottle, so I don't
Yeah. Yeah.
know.
So, if baby's weight gain has been established, breastfeeding has been established well, we know that there's lots of poo and there's lots of pee, and baby is gaining weight, and you're getting stretches at night that indicate that baby is satisfied, then the short answer is no, you don't have to wake them up. And you'll probably see that when they start to take more during the daytime hours. So when you find that the ounce count, if you're bottle feeding, or time at the breast, or just more frequency, whatever it is, they're getting, their volume, they're getting most of it during the daytime, which means that they can drop a feed or two at nighttime and stretch things out.
Yes, I agree with that recommendation. And that's usually by the time the baby's a month old, they're doing better. And the great indicator is the baby's gaining weight consistently. So that will be, your tell that, okay, I can sleep a few more hours
Yep.
at night.
That's awesome. It's a sweet reward when you can hit that point, but don't get discouraged if you just keep feeding that baby so they keep growing. Ladies, this was a wonderful chat. Thank you so much for your time. Guests and attendees, thank you for joining us. I do want to draw your attention. Our next webinar, we do this once a month. It's usually on the third Thursday, and we're going to be together again on June 20th. I will not be here because hopefully I will be snuggling my little baby and working through this breastfeeding journey and with all these great tips today. But it also will be in Spanish. So our next episode, June 20th, is going to be on the topic of adolescence and the use of alcohol and drugs. So really important, especially if you have an adolescent, or one day we're all going to have one if you have children. So tune into that. It will be in Spanish again at noon on June the 20th. So if you want to access any of our previous webinars, again, that will be parentalguidance.org. And if you check out here, you can screenshot this if you want more resources to study along the topics that we've discussed today. So we'll leave that up there for you. But just thank you again to UHealth, Jackson Children's Care, for providing this time for us. Dr. Torres, thank you for being with us. I know you have patients to see and all of that. So thank you for spending the lunch hour with us, as well as Alicia. We were so happy to have you join us, ladies.
Happy to
Thank
be
you so
here.
much. Thank you,
Thank
Alicia.
you.
I learned so much just from listening to you.
Thank you, and
Thanks.
same here. Thank you so much.
Thank you, ladies. And everyone listening, just remember, if you don't have a healthcare provider, Jackson is a great one, and they offer all of these resources at your fingertips, as well as lactation consultants and that complimentary visit. Take it up. If you don't haven't done that, you need to do that, ladies, because that will be so helpful. But thank you again, and hope everyone has a wonderful weekend.
Thank
Thank
you.
you.